You dog.
Appy. Aspen. Oh, are we going to talk about hip dysplasia? What are we going to talk about today? Oh, are we going to talk about hip dysplasia? So I got a request a couple of weeks back to talk about hip dysplasia, and I thought it was a really good topic. It doesn't necessarily just pertain to Australian Shepherds. It's going to be helpful for a wide range of different breeds. Okay, so the first thing that we have to understand with hip dysplasia is what it is. So a normal hip joint has a socket, and then you've got the femoral head. So the femur is a part of the leg, one of the leg bones, and the femoral head is what articulates with this hip socket. And there's a whole bunch of cartilage within here that helps with nice smooth movement. There's a whole bunch of ligaments that help attach these two, and all of the muscles that surround it also help with articulation, and it moves very nice and smoothly within that joint. Now, what happens with hip dysplasia is the ligaments can get a little bit looser or a little bit weaker, muscles can get weaker within that area, and it's not quite articulating properly. That ball and socket joint is not smoothly moving, and it's not really having as much contact. So that causes a lot of issues with wear and tear of the cartilage within your hip socket. So you've got a lot of irregular patterns of wear and tear, and that's what causes a lot of the pain with hip dysplasia. So now that we know what hip dysplasia is, we can figure out what kind of causes it. And like almost everything, there's genetic and environmental components to what causes hip dysplasia. So there is a genetic component in the sense that if you have parents of your dog that are prone to hip dysplasia or have shown hip dysplasia, your dog is probably going to be quite prone to hip dysplasia as well. So that's definitely something that can contribute to hip dysplasia in your dog. Now, another thing is obesity. If you've got a dog that is severely overweight, it's carrying around a lot more weight on its body, then any type of unstable joint is going to have a lot more pressure on it, and it's going to aggravate that joint a lot more. Another component of hip dysplasia is that it has been associated with breeds that have a very large growth spurt within 3 months to 10 months of age. So this would be breeds like Great Danes, German Shepherds, St. Bernards, those kinds of breeds that grow very, very quickly within that time period. That joint can be quite unstable in those breeds. So that's another thing to look out for. So the final thing that can contribute to hip dysplasia is over-exercising a puppy that is prone to hip dysplasia. So if your dog has an unstable joint there, then you don't want to over-exercise or cause any aggravation with exercise that's really high impact. So those are definitely things that you want to consider when you're thinking about hip dysplasia and a puppy. Okay, so now that we know what hip dysplasia is, what things can cause it or aggravate it, now we're gonna talk about how you can prevent it or lessen the effects of it. Because in all honesty, you really can't prevent it too much with dogs that are prone to hip dysplasia. But we can do things to kind of help them out a bit and to minimize our chances of having to, undergo surgery with our dogs. So the first thing, with anything that has a genetic component to it, you always want to check with your breeder. Always, always, always check with your breeder. If the parents are prone to hip dysplasia or have had hip dysplasia, then it's a pretty high chance that your puppy's going to be susceptible to that as well. You just want to make sure that you are buying puppies from breeders that are very knowledgeable about this. You don't want to support a breeder that isn't breeding responsibly, right? So always check with your breeder. Make sure that they have checked their dogs out for hip dysplasia, and that should be a really good stepping stone, the first step to making sure that your dog doesn't suffer too much from this condition. So the second thing that you can do is, like we already said, make sure that your dog does not become overweight. A good way to kind of avoid this in the puppy stages is to not free feed. Don't just leave a bowl of food and let them have free access to that food. You're gonna want to monitor their intake to make sure that they don't increase their weight too much. So the third thing that you wanna do is to avoid over-exercising. This can be really complicated because, in all honesty, there's a lot of studies out there that show that exercising your dog really helps with preventing hip dysplasia. So you don't want to not exercise your dog. You want to have low impact exercises while they're developing. One amazing exercise for this is swimming. So take your puppy swimming as much as you possibly can. It's a very low impact exercise. It's perfect for keeping their joints healthy while they get exercise. So another thing that you can do is running or walking with your dog in short spurts. I wouldn't necessarily recommend running with your puppy while they're developing, but after they have kind of surpassed their growth spurt, then definitely you can run with your dog a little bit more. But any type of exercise that helps develop the gluteal muscles that are surrounding kind of the hip joint area is really going to help stabilize that joint and hold everything in place. So don't stray away from exercise. Now, what you do want to do is avoid high impact exercises. So that would be stuff like tossing the frisbee. I know, you guys, especially for all of my Australian Shepherd owners out there, I know it sucks because Aussies are super crazy about the frisbee, right? But definitely avoiding that while they're developing is really important. Any type of high impact sport is going to cause a lot of negative effects within that joint. So you want to really avoid that while they're developing and while they're growing. So this is now for any owners that start to see signs of their dog being a bit painful with walking. Any owners that are concerned about having an unstable hip joint in their dog, these next two suggestions are going to be really good suggestions for you. So the first thing that you can do is to have omega-3 fatty acid supplements. Their anti-inflammatory properties are super great for the body. It also has great effects on skin and heart. So definitely having omega-3 fatty acids can be something that's very beneficial for your dog if they've got a lot of inflammation within that joint. It's going to help reduce that inflammation a little bit and help with some pain relief. So omega-3 fatty acids, one of the most common areas where you can get that is within fish oils. So if you get fish oil capsules, something like that, that could really be beneficial. My final suggestion for you guys is a supplement that I feel like a lot of people have heard about before. It's called glucosamine and chondroitin. So these two things help with supporting cartilage within a hip joint. Glucosamine is a common sugar that is really important for maintaining and supporting cartilage within a joint. And chondroitin helps with the synthesis of glycosaminoglycans. It's basically a precursor to glucosamine. Remember what we said about hip dysplasia, right? As that articulation surface is kind of taken apart a little bit, the wear and tear of the cartilage is kind of uneven within that joint, and it causes a lot of areas of bone to bone articulation. So the bone of the joint is articulating with the bone of the femur, and that causes a lot of pain. So these two things help build up the cartilage again within that socket so that that bone to bone contact doesn't happen as much anymore, and it minimizes the pain and helps stabilize the joint more. So I hope that you guys have learned a little bit more about hip dysplasia. It's definitely something that affects a lot of dogs, and with prior knowledge of things, we can kind of minimize the chances of our dogs getting it or help them with pain management while they're going through it. So let me know if you've ever had a dog that's had to go through hip dysplasia before, if you had any other methods that you implemented to try and help them. Definitely leave them in the comments down below, and I will see you guys very soon in another video. Take care. Bye.